Statistic is 20% of the population sees a chiropractor. That means 80% do not. That's a lot of people that don't see chiropractors. And the number one thing is there's the fear of the adjustment. The twist, the pop, and not realizing that the pop noise is a gas.
Welcome to the Jeff Glines Show, where business mastery is in the spotlight. Join us as we explore the strategies, challenges, and triumphs with top business leaders. Whether you're a budding entrepreneur or a seasoned executive, tune in for your valuable insights and inspiring stories that power the business world.
Welcome, everybody. We have my guest, Justin Poppe. He is a chiropractor and probably something else, at the end of your title. I'm not sure. You're going to have to tell us a little bit. But he owns Total Health Clinic here in St. George, Utah. And so, Justin, tell us a little bit about what you do, what's your scope of work, and why you got into this type of business. And
Okay.
Yeah, give us a little background on why you started doing chiropractic work. And
So first of all, like you asked what maybe the letters after my name are. So DC stands for Doctor of Chiropractor. So chiropractic doctor, right? Honestly, chiropractic has been something that's been part of my life forever. I started seeing a chiropractor after my mom was in a car accident.
Okay.
And it was very interesting. I saw the x-rays that were done, and I was interested kind of in the anatomy of the body and how it works, and got adjusted for the first time and felt like I wanted to adjust everybody, even as a kid.
Really? Yeah.
And it just intrigued me. And then I looked between chiropractic and dentistry were the two professions I was looking at, and went and observed. And I didn't feel like working on inside people's mouths all day long seemed fun to me. I know that they love it. That wasn't what I wanted to do. And chiropractic is so cool because it's non-medicine. And again, I'm not anti-medicine at all, but it's so nice to see results that happen naturally and get people back to work or back on the field. But I think the most important thing that I'm noticing more, especially as I've been in practice now for about 16 years, a little over 16,
Oh, wow.
yeah. Working with the other medical doctors, the medical community, with nurses and DOs and MDs and nurse practitioners, and physical therapists. There's such an ability to bond these practitioners together, to work together, and that's part of what one of my goals is, to always be willing to work with any medical side. But at Total Health Clinic, part of the reason why the name is what it is because it's to encompass total health. Even if we may not be able to help you, our goal is to find where you need to go to. So referring out. If I need to refer to a specialist, whatever it may be, a neurologist, physical therapist, we work with a lot of, definitely locals, of course, but our objective is to make sure that the person's total health is able to be addressed. We've been upstairs for 5.5 years. I was downstairs in the same building for the other years. What I focus on, more disc issues. For instance, if there's a herniated or bulging disc, strive to help reverse those effects. I work with a lot of joint issues. The cool thing about the involvement of chiropractic in the profession is we're able to even do non-drug type of injections. So one of them being an example of like ozone or PRP. PRP is platelet-rich plasma, where we draw your blood, spin it, and then we re-inject it into the tissues of the problem area. So we use decompression, we use shockwave. Shockwave is a device that is two components. It's mechanical percussion, so a series of taps with acoustic sound to break up adhesion, scar tissue, to help accelerate the healing. We create a microtrauma with this device, and by doing so, it brings more blood to the area and healing ingredients, stem cells, and other properties. And then cold laser therapy. It's a warm feel device, but it's called cold because it doesn't cut tissue, whereas like a dentist would use more of a hot laser to cut a gum line or whatever it may be. So we're using more different modalities, not necessarily physical therapy modalities, but other modalities to reverse the effects of what may be going on in the spine. And so that's what I love. traditional chiropractic, I still do it. But I think the hard part for a lot of people that are out there, the statistic is 20% of the population sees a chiropractor. That means 80% do not. That's a lot of people that don't see chiropractors. And the number one thing is there's the fear of the adjustment, the twist, the pop, and not realizing that the pop noise is a gas. It's nitrogen that's being released from that joint. So it's not a bone and a bone going against each other. It's a gas that actually causes an endorphin release. So it feels good. But I think the misconception is it's like chiropractic hurts or it may hurt me, and what about this condition? And so I think the number one thing that we do is there's an evaluation. We do an examination, x-rays, to see where the person's at and what treatments they need. So I mean, I think maybe that's
yeah. Well, no, that's good. That's good info.
Right?
Yeah. So you told a lot of stuff there. So what would you say kind of sets you apart from? I mean, I know you mentioned the Total Health Clinic and you do a total health, but maybe give me in a nutshell what sets you apart from, I guess, the other chiropractors that are practicing. Maybe.
I'd say two things. I think one, first and foremost, I think here's the other thing too. I think there is a huge...
Hey, I hope you're enjoying the show with Dr. Poppe. I just want to take a quick break here and let you know, if you're paying too much in credit card processing fees, we can help. Just like Dr. Poppe, we're able to help him and tailor make a plan for his office to be able to save him a lot of money. If you want to learn more about how you can save money on your credit card processing in your business, you can just click on one of our links here in the podcast, in the YouTube channel, whatever you're on, or you can just go straight to merchamax.me. That's merchamax.me, M-E, and you can start saving today.
I'd say two things. I think one, first and foremost, I think here's the other thing too. I think there is a huge stigma that we as chiropractors are trying to compete with each other. I don't think we need to compete. Number one, I think if anything, part of this video, if any other chiropractor listens or anything else, we need to be on the same team. Because the reality is, it's like, even to, as an example, perfect example, social media. You go on to, word of mouth type stuff. What chiropractor do I see? Which one's the best? The reality is everyone's experience is going to be different. So I'll even sometimes even chime in and just put, go try one. Because the reality is, like, yeah, I mean, we all have our favorite chiropractor. We all have this one that you got to go see. He's amazing or she's amazing. But to me, the reality is, like, this is what we do for a living. And I think, so going back to what I'm probably really good at is listening. I'm listening to the patient to find out why they're here. We do a really good intake form that allows us to see a lot of questions that get answered. And by doing so, it allows me to know which direction that I may need to go. Doing images, I think, is super important. That's another thing too, is there's so many chiropractors that don't do x-rays because they don't have it in their office, which is totally fine. And then referring out to the hospital, and that process can take a long time too. And when people are in pain and they want relief, sometimes it's like, hey, just get me in, adjust me, and get me out the door. But it's nice to know what's going on inside that spine. So I think a combination of listening, doing the proper diagnostic steps, allows me to be a good practitioner, to be able to give them what they're expecting, and with a positive outcome. And that's the thing, is I would say too, is from a chiropractic standpoint in general, all of us as chiropractors, we should be on the same page of doing that. So I would say that my thing is listening, doing the proper diagnostic stuff, and giving them the right treatment that they need.
Nice. Well, so this might be a question. Like, when you first got into chiropractic, I know you mentioned you had yes, it was your mom, or what was that?
So yeah, my mom was in a car accident in California.
Okay.
Yeah.
And you saw that whole process, and
yeah, very fascinated. Yeah.
Yeah. Okay.
Yeah.
So if you were to give some advice to the younger generation coming up, why they might want to look into chiropractic, what kind of advice would you give them if they have a little bit of interest in that and they're leaning towards that? What kind of advice would you give?
So I think there's several things though. I think for me, it was knowing, so like for instance, right, you have an earache, you get put on a prescription and you take it for the next 7 days or 10 days, whatever it is. And you think about it, every time you take one of those pills, it's a form of a treatment. but that's not really what it's talked about. It's like, take this 2 times a day, for the next 7 days, not realizing that it's really saying that you're doing forms of treatment from the medical side, the medical model. With chiropractic, like if you get a muscle twinge in your neck, and it's from sleeping, maybe as an example, you come into the office, we do all the proper diagnostic stuff. In that adjustment, we're going to have at least a 50% increase of range of motion, reduction of pain, unless it's something dramatic, like a disc issue, where again, where that disc is putting pressure on that nerve, that could cause a longer series of treatments. But yeah, so when I was before going to school and anything, I love to be able to see that someone could get hurt from playing football and then get back on the field, even in the same game. And that just fascinated me, of the fact that we can do something to help remove an interference from the body, be it the spine or a joint, and get someone back quicker without potentially masking it or putting them on some form of potential surgical procedure where there's nothing wrong with these things, but if we do a quick evaluation and treat it. So that's what really kind of excited me, is that there's an alternative that's out there. Okay. And just to see the result, like it's sometimes with these adjustments, just to see a patient instantly happy, can just feel that pressure get released and removed instantly, and then back on their feet and moving. It's rewarding to watch that. So from a school standpoint too, it's like chiropractic, it's the same schooling that a medical doctor goes through. Again, same time frame, but different focuses, right? Yeah. Where in medical, there's a lot more pharmaceutical, whereas chiro, there's a lot more anatomy and biomechanics of how the body moves and functions, so that when we adjust it, what are we doing correctly? So that's where PT and chiro are similar in a lot of, there's a lot of similarities, but there's still a huge difference of what we do.
PT meaning
physical therapy,
okay,
PT, physical
I'm sure
therapy.
most people will figure that out, but.
And here's the thing, like, so if one of my kids said, hey Dad, I want to be a chiropractor, awesome. It's a great profession. But I also think it's what my encouragement would be is come even to our office, seek out a chiropractor, say, hey, do you mind if I follow you around for a day? Because it needs to be something that you would potentially enjoy, and to be able to see how the flow is. Some chiropractic offices, there's open bay adjusting. What does that mean? It's where you'll have several tables and people are all in that room being adjusted by 1 or 2 chiropractors. So it makes it,
lots of different models.
There's a lot of different models. Whereas kind of medically, it's you're in one room, you're waiting for the doc, then you kind of talk about what's going on, why you're sick or what's going on, and then you could potentially get referred out. That's the thing too, is from the medical model, again, there's almost a different form of structure of steps, where chiropractic, they can come in and be treated and see a result then. Whereas medically, not that they can't see a result right away, but in most cases it's, we got this going on, we got to refer out to a specialist or anything else. So there's a lot more steps that they may have to go through. So again, for me, it's just very, it's awesome to watch.
Yeah.
Just the results.
So you're recommending people shadow another chiropractor?
Yeah.
Or multiple chiropractors to see, because everyone's probably doing something different.
Yeah.
Or have a little bit different flow in what they do in their business.
See, I think, like, going back real quick, like dentistry really intrigued me, but when I went and observed, it was like, no, it's not my cup of tea. Whereas chiro just felt more in alignment with myself.
So, in the medical world and in chiropractic and all these different physical therapy, there's always a business side to it. And so what would be a recommendation or things that you have found over time running your practice as far as business sense, and what's some good things they can even do? I mean, obviously they got to go to school for the chiropractor, but I've always heard people, hey, it'd be nice if you can do business classes because of this. And what have you found, and what has evolved to make your business, run good, exactly, but also profitable, be able to pay your employees, keep happy employees, and all that, pay your rent and everything else.
Yeah. That's one area that I think is a little bit more difficult in the chiropractic setting, is you need to have business sense. I think sometimes, and I'll do this a lot, like this is the thing, I always compare it to the medical side, just because again, that's kind of a little bit of the opposite of what we are, right? Everyone needs a medical doctor. At least that's what we've been programmed to do. It's like, if you have an owie or if you have some form of sickness, call the doc, get in, and there's some sort of, prescription that they're going to give you. So it's easy for a doctor, like a medical doctor, to basically get full. They can be a brand new doctor in a matter of months. They don't even have to advertise. It's just, hey, there's a new doctor in town. Chiropractic, like I said before, statistically, 20% sees a chiro. So that's not a huge amount of the population that sees a chiropractor. So a chiropractor has to have a little bit of business sense to be able to get himself out there or herself and market themselves at whatever fairs or other opportunities to try to basically say, hey, this is who I am, this is what I offer, and a lot of times even give like a little freebie, some like fluffy treatment, just to basically say, hey, this is what potentially could happen in this office visit. Come try me out. I'm brand new to the area. But I also think that's where, like, even from like a LDS, Latter-day Saint missionary standpoint, like it teaches you a lot of steps of selling. So resolving doubts and things like that. Same thing in chiropractic. It's sometimes, someone might come in for a visit, but really they need probably 3-4 visits. What are we doing to resolve doubts or different circumstances to make sure that we, as from the business side, that it helps us to not only treat them, but also get paid for what we do. So it's important to be a good doctor, but I think also having the business sense of how to do it. A lot of chiropractors want to own their own business right out of practice. So we don't have to do a form of an internship. So we're like the medical side, they have a residency, usually have a year, right? And then they go wherever they go, and then they move back. Chiropractic doesn't have that. And you can easily go shadow the latter part of your year of school, but a lot don't also, just because they have classes and adjustments to graduate. But I think that going along with that too, it's the chiropractic side, they want to own their own business, where I almost feel like too, and this is, again, if I was to do it all over again, I would, especially from a school standpoint, I would do a year with somebody. Go in with somebody that knows their craft. Like, again, I've been in practice for 16 years. Go in with someone that has some experience, see what they're doing, all the good things, and maybe some things that you see that are bad, so that you can emulate those. And then when you go on your own, you'll be even better. So that's another thing that I would add as a tidbit of, I want to open my own practice, be on my own. There's so many hoops that you're going to jump through and so many mistakes that you're going to make. That would probably be a really good piece of advice, especially.
So go in with someone else, or at least work for another chiropractor in their office, get some experience, and then if you feel like comfort level, and then move away and start doing your own practice.
Totally.
Okay.
Yeah.
Well, that's great. That's awesome. So with running a business, it has to be profitable, and it has to be able to feed your family and whatnot. And there's the financial side. But what would you say drives you more than the finance side? What drives you besides helping a patient or something? But what's another motivator and a driver for running your own business?
Schedule.
Besides money.
Schedule.
Okay, why? Tell me about it.
So, again, if comparing apples to oranges, but like the medical side, a lot of times they're open Monday through Friday, sometimes even Saturdays, or if it's tied to a hospital, they have different hours. Usually longer. I think from a chiropractic setting, I can pick and choose which days I actually want to work, but also depends on how many patients I'm seeing. I typically work Monday through Thursday. I usually take Friday through Sunday off. But like even today, I worked Friday. Why? Just because, again, the demand of patients, you need to do it. And so every week changes, but ultimately I get to set my schedule. Like, it's soccer season, so my boys that are in high school have to get out of work a little bit earlier, so I can set my schedule so I can get out. Whereas if you're a 9 to 5er, you're working till 5. So I love that flexibility and that ability where I can work till 9 o'clock at night, or I can get off at 4, or whatever it may be. Nice. So I'd say schedule is hugely important.
Probably with a family, for sure. What have you done, or what do you think is kind of creates a company culture?
So I think it would be good to just even give the opposite side too. Like I've had in my 16 years, I've had to go both ways. Been very, very productive, have a really good staff, and there's been other times where it just hasn't been flowing. And just there's butting heads, there's difference of opinions, things of that nature, to where it can actually create toxicity. And I've not been great in the past, partially because I'm a pleaser in a lot of ways too. So it's like you're trying to accommodate to both sides. And so if you're wearing that business hat, unfortunately, you got to be the mean guy sometimes too. And try to help get that exchange back. Because I think that that's a term that I've been using lately, is that exchange, where it's from that side and my side, there has to be a good exchange for basically like product and money, right? So it has to have that value. And if the value is no longer there, it's like you got to get rid of it. And we recently, within the past year, we've actually gone through quite a few employees for one specific job. And we're whole again. We're back, but it's team meetings. I think for me and my success is communication. So doing regular team meetings, doing morning text messages before you start. This is what's going on today. Let's make sure we're all on the same page. If there's questions, readdress at lunchtime, and then kind of have a closeout, quick brief meeting or a text just of communication. So communication's key, right? And all things, right? So
yeah.
I feel like that's what's putting me in a better place to have a successful business from that side of things.
As creating that culture. What role do you think AI will have in the chiropractic industry, or do you think there's any room for AI? Is it going to come in? I mean, what's your thoughts on that? It's just always interesting because AI is evolving all the time.
So I don't think AI will ever have a impact from the adjusting side because it's hands-on.
Yeah.
But I think AI will help assist with marketing. I think if anything, it'll actually be beneficial long term, just because scripts, putting how I want to do a newspaper ad or how I want to do a Facebook post or things of that nature. Okay. So more from a marketing standpoint, I think it could be huge.
No robots are going to be taking over your...
No. It's not like a Mickey D's, I think Parrish has got some,
Flippy. It's called the Flippy.
Is that what it's called?
It flips the burgers and puts the fries in the...
That's hilarious. Yeah, I don't think there's going to be anything because, man, could you imagine having a patient that's extremely arthritic and it's like same protocol for someone that's 25? You're probably going to break some ribs or something, right?
Yeah. That's
powerful
good.
Punch pushing through, by a Flippy.
It's always an interesting question of the AI thing because some industries, last guy I talked to, he really sees AI taking over all of his engineering software and doing cost bidding on the construction job. I mean, it can do it all. Yeah, it's amazing. Like before they had guys counting the stuff, But what have you done? Because you've obviously went through COVID and things like that. What have you done to adjust for those downturns or even times of more downturns? Because that's where it's gonna be easy to adjust to economic boom. Yeah.
Well, I think it's like with any, especially being a business owner versus being an employee, right? W-2, you just assume that this is your paycheck and this is what you're getting. But like even somewhere in St. George where the industry of real estate, right? Builders and real estate agents, it's ebb and flow, it's up and down. So I think it's just being smart of your money. Just because you're making more money doesn't mean you spend more money. Because you got to be prepared for those times. Like COVID. COVID was a hard period of time because for us, so that's COVID, so many older patients that are more of the Medicare age, 65 and older, weren't coming in. Because the fear that they would get sick. Even though they were having aches and pains. And once kind of COVID, especially once the mask restriction was taken away, for some reason that restriction being taken away made it so that people felt comfortable to come back into the office. So then of course that happened. So there was that moment to where again it's are you saving? Are you not overspending so that you can survive those ebbs and flows? And like in St. George, every place is different, right? Chicago versus Miami, Florida, Vegas, St. George. St. George is an interesting place because there's a lot of snowbirds, right? So and we see a lot of older people. So during summertime when it's really hot here, they're leaving. But what's interesting about St. George is what at least what I've noticed over the years is we see a lot more younger people than what we normally do, from boating incidences, whiplash type scenarios, yard work, lots of play. So it kind of shifts it. So instead of seeing a lot more, 65 or older patients, we're seeing a lot more younger with kids or even just younger husbands and wives. But the ultimate thing is just not overspending. Yeah. Like, especially for us, like for right now, summer is a time where we definitely try not to spend much. Equipment isn't usually purchased during that time. It's usually winter towards the tail end or even maybe springtime.
Gotcha.
So,
okay. What would you say as far as your patients? Is there a certain type of patient, or is it pretty much just across the board, or do you market to certain patients, or what's your perfect clientele?
So we have 3 chiros in the office.
Okay.
And a nurse practitioner. But with the 3 chiropractors, there's a lot of differences. His focus is pediatric pregnancy. So it's definitely the younger age of babies or little kids or pregnant women. Like myself, I focus more on disc issues, joint issues. The other doctor focuses more with neuropathy. Okay. So there's a lot of different scenarios. One of the things that's really cool that I've been doing in my practice for quite a while is also peptide therapy. So
What is that? Yeah.
So peptides are amino acids that our body already naturally produces. But what happens as we get older, a perfect example of one that is amazing, it's BPC 157. So body protection compound 157 is the name of it. It's a 15-chain amino acid that they even actually call it the Wolverine peptide, just because of the healing properties. If you have a lot of system issues like stomach issues, leaky gut, for instance, it'll help fix those issues. But also too, if there's a lot of joint pain, maybe previous injuries, it works really good. So I really like diving into new technologies, new things that are out there, and I typically I'm willing to go out and experiment and learn and try to evolve with it in the beginning process. Whereas a lot of chiropractors now, or even medical doctors, like semaglutide. Semaglutide is a peptide. So like Ozempic, that everyone is hearing about type 2 diabetes, right? Ozempic is semaglutide, but it's the medical version. But at the end of the day, it's a peptide. I mean, even to insulin is a peptide. But we've never, well, not never, but the majority of the time we never have thought or have been told that insulin that's been around for a very long time that's used for type 1 diabetics is a peptide. Peptides, they're safe. There's always risks in the sense of, like, if you overdo it too much can cause symptoms of nausea, diarrhea, whatever else. So I just think, again, there's a lot of variations of form of practice that we do here. But like I said before too, I think what also kind of sets us apart is we work with a lot of medical doctors in town, with pain management doctors, with orthopedic surgeons, spinal surgeons, physical therapists, is the fact that when we're not seeing the results that we want, we'll refer out for a second opinion or co-treat. Like right now, I have a patient right now that is trying to avoid surgery, and the orthopedic surgeon likes the care plan that I'm recommending to this specific patient, and we're just communicating to make sure that if he's getting the results that he should get, no surgery. But if we're not getting the results, there's always that ability to go back. So I feel like that's another thing that kind of sets the clinic apart, is we're willing to do that.
Oh, that's awesome. I love that. So if someone's liking what they hear and they're like, gosh, I kind of resonate with Dr. Poppe, what would you, I guess, any type of recommendation that you have to maybe come in and see you, try you out, or kind of give us a little spiel on that.
One other thing I would add to is, like I said before, joint pain seems to be probably one of the most common things that most of us deal with. Pickleballers, right? All these activities that we're doing might be a shoulder or a knee or even a hip. I love joints, just because, I mean, the first thing too, like, when I talk with a couple of the orthopedists in town, it's when a patient goes to an orthopedist saying, I feel like my knees are worn out, you x-ray it and see that they're diminished and they want to get back to play and everything else. It's like, it's a knee replacement. And again, I'm not anti-knee replacement, but once we replace something, you can never go back to the original product, right? So with that, I like to do a lot of regenerative type medicine, and that's where, like with a nurse practitioner, it really steps into, where we can do like exosomes that are part of like the stem cell family.
Oh, okay.
There's a lot of cool things that are out there that can help reverse the effects of age and damage. So with that being said, I feel like for me and in our clinic is I always do a free consultation. I feel like, you know, I'm never going to be at a point where I feel like I want to ever charge for a consult. And the reason why is I want you to walk in, feel comfortable knowing what type of office this is. You get to meet with the doctor. You get to talk about what the issues are, what concerns they may have, and we address those. And with doing it just that way, we typically win them over with the whole circle of things: the office, the staff, the consultation, and then the potential road to recovery. But again, every treatment that we do, some is covered by insurance, some are not, but we go over that too.
Yeah.
So there's never something where, you know, well, how much is this going to cost me? Well, we're going to talk about that. It's not going to be a problem. Does Medicare cover? Yes, Medicare covers some things, but doesn't cover everything. Does my third-party insurance, Blue Cross, for instance, does it cover everything? No, but it covers some things, but other things not. So that's why I think the consultation is so important. It allows them to come in, kind of, you know, test the waters, see if this is the right spot, see if what we have could benefit them, and if not, same thing. We'll refer you out to someone that might be able to help you.
Yeah, that's amazing. Most people don't know about you, and in general, maybe share something that maybe some of your passions that maybe a lot of people don't know about, and what you love just in your personal life as far as hobbies and family or whatnot.
Okay, man, I could throw a lot of stuff at that one. So from a hobby standpoint, I love golf.
Okay.
Love being outside. Surfing's great too, you know, behind a boat.
Yeah.
You know, that type of surfing's a lot easier, you know. No sharks either, you know.
Yeah.
I think for sure family is so important. That's why too, going back, I think with this profession, it's allowed me to have a lot of free time. I have 6 kids. Our twins that are 7, we adopted them, and they've been a great addition to our family.
Oh, that's awesome.
I love watching my kids achieve goals and things that they do with sports, with music, whatever talent it is. And I think what's probably the best thing that I could probably say too, and I think, you know, most guys can all agree with this, but like my wife who's behind the scenes, I feel like I'm not behind the scenes. I get to talk to people all day long. I'm kind of out there a lot more. But just having a strong backbone of a support of a wife is huge, and I can see it in my kids. I have amazing kids. I range from 20 all the way down to 7, and to see how they operate, how they treat each other, how they treat others, I think is a huge testament of how she is. But also, I think it's also because we have a good marriage, and so I think it's been great. And then we have our freedoms. She's an amazing singer. She does her things to where she can continue to focus on her craft, and then, you know, golf's it's a passion more than just a hobby. And I don't know why. There's just something about it. It's like you could have a horrible day on the golf course and it's still awesome, you know, because there's always gonna be one shot or one putt that you do that.
Thanks again, Dr. Poppe. It's been fun talking to you and interviewing you, and so look forward to maybe some more interviews in the future.
Hey everyone, go take Dr. Poppe on his, take him up on his offer and go check out his holistic practice of total health care. You can go to his website at totalhealthutah.com. You can give him a call at his office at 435-656-2888. Again, that's 435-656-2888. You're listening to the Jeff Glines Show. Go follow us on Facebook, Instagram, TikTok, LinkedIn at Jeff Glines.